Hello, good morning, everyone. My voice is audible to you. Can you guys reply me with your emojis so that I can understand? My voice is reaching everyone. Can you give me emojis or reactions? Is my voice is audible to you? Yes, Sahid. Yes, Sanuja. Is everyone? We are starting the session now. So can you? Yes. Okay. 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 Can you reply me in message starts also? Okay. Okay. Thank you. Thank you for your confirmation, guys. And my slide is visible to you, right? Yes, my presentation is also visible to you. Okay, thank you. Okay, we can start the session now. So, good morning and greetings from Cleanoxy Solutions Private Limited. Welcome all Cleanoxy Medical Scribe Demo session. So, today we are here for the medical scribe demo session. So, I want to tell you about Cleanoxy Solutions Private Limited. Okay, so where I'm introducing about company, I feel great because Cleanoxy Solutions Private Limited is the only clinical research organization in India affiliated by Indian Pharmaceutical Association and American Accreditation Association. So, I want to introduce more accreditations and affiliations from Indian government as well as US government as well as international and national accreditations from we got a Cleanoxy Solutions Private Limited. So I want to first introduce international and national accreditations which we have from Cleanoxy Solutions Private Limited. So first I want to tell you about national accreditations. Like national accreditations, we have Indian Pharmaceutical Association. We are only the first clinical research organization recognized by Indian Pharmaceutical Association in India. And another accreditations we have like LSSDC, Skill India, ISO, MSME, and government affiliated. And also we have startup recognition also in India. Coming to international accreditations, we got American Accreditation Association. In India, we are only the first clinical research organization got approval from American standards and American accreditation, American government. So this is our sample certification, which we got a certification from American government, and this is the Indian government accreditation, Skill India and LSSDC. Like now, I want to introduce our young dynamic director of Cleanoxy Solutions Private Limited, Satish Kumar Vemarpusar. Sir having experience, 11 years of experience in clinical research, pharmacovigilance, clinical data management, regulatory affairs, and medical devices. He is having a experience worked with multinational companies and contract research organizations like Paraxel International, Clean Choice, Sign, Tech Mahindra, and Granules India Limited. And Sir got awards and recognitions. So Sir got awarded Career Empowerment Leader Award in 2022 in our WIP and IPA Telangana branch. And Sir is a speaker in 73rd IPC Hyderabad and 72nd IPC conducted in Pune. And he is a speaker in IPSF Congress, Haryana and Raipur. And Sir having certifications like certified as an advanced career counselor and certified into you as and SUED regulatory notified body in India. So I want to invite Sir. Good morning, sir. I want to introduce like our director wants to talk a few words about this demo session. So I want to introduce Satish Kumar Vayanvarpu, sir. Take your time
Yeah.
to 2 minutes.
Good morning. Good morning, Ravi. Thank you. Thank you for the valuable introduction about me and the organization. And I feel very great when I'm going to introduce about Platoxy because that is what achieved excellency in clinical research industry in India. So, in this session, we are going to know about what is medical scribing, what are the opportunities we are having, what are the companies we are having, and what are the growth we are expecting in India and international market. And I'm welcoming you guys and kindly learn. And if you have any doubts, any clarifications, you can approach our admission counselors as well as the mentor. And wish you good luck, everyone. And yeah, Ravi, you can go ahead with the process. Yeah.
Okay, sir. So now I want to introduce our today's trainer, Dr. Devi ma'am. She is having 6+ years experience in corporate companies in medical documentation and medical scribing. So good morning, ma'am. So I want to hand over session to you, ma'am. Welcome to Clinoxy demo session. So Dr. Devi ma'am, my voice is audible to you. Are you there, ma'am?
Yes, Mr. Ravi. Thank you so
Yes,
much
yes,
for the introduction. First of all, I would like to thank all of you. Thank Lenoxy, you and Satish sir for giving me this opportunity to connect with such a esteemed organization. Lenoxy is one of the organization which is not just like there for the sake of the sake, or it's like a profit building business. It is one of the very, very few organizations that I can say proudly that is associated with training people from life sciences into beautiful careers, shaping their beautiful careers in future. So yes, thank you so much. Uh,
yes, ma'am.
if
Ma'am, I'm giving a host. I added. I make you a co-host, ma'am, so that you can share your slide.
Thank you so much.
Thank you so much, ma'am.
Ravi, if you could confirm that you can see my screen.
Yes, ma'am. Yes, ma'am. Yes.
Thank you so much, Ravi. So, hello everyone. As he has already given the introduction, so I'm Devi. I'll be your trainer, and as you already know, so this is virtual medical scribing program. So all of you might be having the questions. First of all, like what is virtual medical scribing in the first place? So virtual medical scribing is a program that allows you to be partnered, to be associated with directly under healthcare professionals abroad. So not only it is a very respectable profession, the other thing, important thing is you will be associated directly, like one-to-one contact with the providers abroad. So it gives you direct contact with all the healthcare professionals. So that is another main important thing. So, coming to the program in itself, there are the key topics that we need to cover. As you can see on the screen, so first of all, we will deal with the introduction to medical scribing. So, what is medical scribing? As I have just mentioned now, so medical scribing is nothing but providing medical documentation services to providers abroad while you visiting virtually from India. Okay. So the next question, why choose a career as a virtual medical scribe? So as we all know, uh, a lot of professions in India offer, good career growth, but virtual medical scribing is one career that is not only, as I have mentioned, gives you good economic growth, as well as it allows you to learn different culture, it allows you to impart your knowledge and expertise in various departments, and also it allows you to connect to directly to healthcare professionals abroad. So you will be doing the real time documentation, associating with different providers. So we will talk about the overview of the training program. So the training program is really in depth. It's a comprehensive program. It's a very brief program where we will provide you all the opportunities and all the training that is required for you to not only start, but also like really involved with the medical scribing process. So career pathways and opportunities, I think Ravi will discuss, can give you more idea later on. So, so introduction to medical scribing. So basically, a medical scribe is a professional, a trained professional who assists healthcare providers. So by healthcare providers, not only I mean doctors, but also nursing practitioners and doctors from not a specific specialty, but different varied specialties, including general medicine. We have pediatrics. We have different specialties, right? So you can be associated with any of the specialties, and you can also be associated with the nurse care practitioners. Okay. So you will associate with them, you will assist them in the medical documenting process. The thing here, the key point to note is you will be connecting with them in the real time. So in the real time, you connect with them via different softwares, real time. You virtually hear the conversation and you document it. So you follow the physicians directly throughout the visit. You get the information, you put it in the EHRs. EHRs are nothing but electronic health records. So these are the websites where you are supposed to document the data. Okay. So this the rule allows you to directly connect with healthcare providers. You are directly the bridge between doctors and providers. So that's a very respectful and decent job. Then, impact on healthcare. So, medical scribes play a crucial role in improving healthcare efficiency and patient satisfaction. What do I mean by this? If a healthcare provider's focus is solely on the documentation process, taking the information, whatever patient is mentioning, I don't think they have the time and they don't have the mindset to deal with the patients, to give the patient 100% of their attention. In other way, if you as a medical scribe is already present there and you completely take over the responsibility of documenting the patient note, then they can fully provide their 200% or 100% of their undivided attention solely to the patient. So, this gives the providers utmost relaxed, peaceful mind to give their focus to patient, and patient will obviously be very satisfied with the healthcare provided to them. Along with that, by taking over the complete responsibility of scribing medical documentation, you are removing the burden off of the doctor's heads. So they can spend very much quality time with their family members and they do not have to sit back and complete this documentation process. So they will be relaxed, they have time to deal with their other things, they have time to spend with their families, and patients will always be satisfied. So it's a win win situation, both to the patients, both to the providers, and obviously it gives a good career for us. So I would like to take a moment to again thank Clinoxy Solutions. So the certification that Kinoxy provides is not only valid in India, but it is valid abroad as well because we give a globally valid certification. It is affiliated with AAA, American Association, also LSSDC from India. And I would like to also mention this one point that Clinoxy is the only certified program that is authorized and affiliated by IPA as well. So we are the only one and we are the best. So, yes, overview of roles and responsibility. Yes, we have learned about medical scribing. What is it? Who needs it? And why do they need it? Now, what are the roles and responsibilities of you as a medical scribe? So, first thing, as we mentioned, is real time documentation. By real time, I mean that you are present with them at the moment when they are connecting with their patient. So you hear the complete patient encounter. So you record the diagnosis, you record the treatment plans, you record the patient history, every single thing. So real time documentation it is. Second thing, EHR management. Where do you document this information you ask? EHRs is your answer. So EHRs are nothing but electronic health records or electronic medical records. There are different EHRs available in the market. So there is ECW, which is e-clinical works. There is Epic. There is Athena. There are different electronic health records available in the market. And we at Clinoxy will provide you information related to every single one of them so that you can kickstart your career right away. Next one, communication support. So you are facilitating a bridge, you are facilitating a communication, smooth transition from the documentation, which helps healthcare providers and their staff members. Have you asked? If you directly document every single thing clearly in the EHR, you are giving the nurse care providers, you are giving information to the pharmacist, you are giving the information to the dispensing people at the pharmacy, you are giving information to the patients as well. You are giving a clear cut instruction regarding the medication, you are giving the clear cut instruction regarding the lifestyle modifications, you are giving a nice introduction, clear indication about the medication administration and all of the other non-pharmacological treatment. Along with that, administrative tasks. You will be assisting them with scheduling the follow-ups and billing as well as coding support wherever necessary. So why choose a career as a medical scribe, you ask? So first thing, high in demand. So I have already mentioned no doctor wants or can I ask you this? Do you want to work like 9 to 5 and again go back to your home without spending time with your family and, you know, sit with the documentation and keep doing that? Does anybody want that?
వాళ్ళు 36 మంది
Yes, Vijaya. No, right? So, yes, this is very much high in demand only because of the fact that it allows healthcare providers to completely focus on their patients and on their professional work only in the time when they are in their hospitals. And after going to home, they don't have to deal with this work at all. So you are completely removing the burden off of their heads. Second thing, flexibility. So this medical virtual medical scribing provides you remote works as well as work from office as well. So depending on the company you choose, depending on the role you choose, you will get the flexibility to work accordingly. And this also provides you a decent work-life balance. So as we already know that healthcare providers abroad have a fixed routine, have a fixed schedule. The schedule is almost always pre-planned. So according to the schedule, they go along. So you will not be asked to do overtime, extra time, work for extra days, or something else for the same pay. You will be paid according to the hours you work, not a minute more, not a minute less. Maybe a minute less, but never a minute more. And trust me, if you work extra, you will get paid extra. So it's an hourly pay. So it's again a win-win situation. Then career growth. So as we already discussed, that this obviously has a high demand because obviously you are doing a key role in documentation and you are allowing the doctors to spend time with their family and do not be indulged with this amount of work dealing with the documentation. So there is different opportunities available not only as a virtual medical scribe. Moving forward, you can go to other positions as well with this knowledge and expertise. Then a meaningful impact. So, not just any job where you don't actually know what is going on. Here, you actually know what is going on and you are directly involved in improving the patient care. So, it gives you so much job satisfaction. Before going towards the overview of training program, I would also like to add a few points regarding our training program. So, we give in-depth training, not only the overview, our trainers, we as trainers associated with Greenoxy, we are working professionals. We do not give you bookish knowledge, the traditional knowledge that does not help you in the long run. We give you the information that helps you, allows you to directly start your career. We give you practical knowledge, industrial experience. We prepare you for what you're going to go to work with. You are not going to learn something that is unnecessary. You are not going to learn something that is old fashioned or that is over. We are going to learn something that is happening right now. We are going to learn things that is going to help you in the future directly when you start the career. So, again, moving back to the training program. So, our program structure consists of 4 sessions per week over a 4 month period, providing a balanced mix of theory and practical experience. As I said before, not only are we focused on giving you materials just for theoretical approach, we prepare you for the actual work. So we focus more on the practical work than we do on the theory. The key skills we teach you, medical terminology, documentation techniques, especially SOAP note. What is SOAP note, you ask? Subjective, objective, assessment, and plan. The complete documentation. Along with that, we give you in depth knowledge regarding electronic health records. As I have clearly mentioned, what are these? So, the documentation facilitating websites, different softwares at that, and real time scribing practices. We give you the certification that is not only nationally, internationally valued. So, the certificate provided by Clinoxy is valid abroad as well. And as we already know, we are upgraded by the American Association as well. So, our certification will not only help you work in India but also work abroad. During the visa processes as well, our certification definitely helps you clear the process really quickly and helps you work abroad with the same certification. So go ahead and use this wherever, whenever you want, all around the world. Isn't that great? Next, post training support. Not only we give you training and just leave it at that, we will help you until the point you are clearly, happily settled with your career. So I think, Ravi, you would be better person to talk about the compensation and stuff. So
Yeah, yes, ma'am. And after this slide, also we have some like I will start from these opportunities also, ma'am. You can also just discuss about like what the queries and have.
sure, Ravi, sure.
Then again, I will revise the session from this slide onwards.
Thank you so much, Ravi.
Yes, ma'am.
So again, guys, career paths, pathways, and opportunities. So these are the figures that you can expect. A entry level scribe would expect a salary of 4 LPA for sure, but it also depends on your caliber during the interview and the organizations you work for. So I can say this is not the ultimatum, this is not the maximum you get. You can get even more as well. I know people who are earning about 50,000 within a year, not even 6 months into the job. So it all depends on how much you work, how much the work you put in, how much experience you have, how much hardly you are doing, and the company, especially that you're working for. And an experienced scribe can progress to 6 LPA. This is the minimum figure that we are giving you. There can be so much more as well, and a little less as well, depending on the company that you are applying for. And you can move to become a team lead, assistant team lead. You can be a trainer. You can be a experienced scribe, as well as you can be a person who helps other people settle with their providers. That is nothing but implementation specialist. So there are different pathways that you can choose once you get the experience. And you can move forward and become a person who deals with the administration as well. That is, you can become the operations manager. So there is a lot of career trajectory. You can always aim for something higher. There is a lot of opportunities. So, yes, given below are some of the medical scribing companies that are there. We just listed the few companies, but there are, trust me, so many more. So we have Equity Solutions. They have branches all over the India, one in Visakhapatnam as well. They offer really good packages and a very good systematic approach. We have Scribing also has an office in Hyderabad, Telangana, and they have offices obviously in Bangalore, in Mumbai, and different other places. We have virtual physician scribes. That's an organization that only works online. So you do not have to work from office. They provide complete work from home. We have Infotech. They have offices in Noida as well as Mohali. So you can have work from office opportunities with them. We have Cognidex, who have their main branch in Bangalore and they provide work from office opportunities. So different companies allow you either remote opportunities or work from office opportunities depending on your caliber and the company you choose. So good luck with that.
Yeah, ma'am.
So
This
yes.
is a interactive question and answer session, ma'am.
Okay,
Like,
thank you so
if you
much,
guys
Ravi.
any questions you have, like you can ask. So, ma'am is here to clarify your doubts. So you can unmute yourself and you can ask the question. Any student, anybody have any questions? This is like a interactive session. We can give guidance and clear your doubts, what you have about your future, or else about the training program, about whatever it is.
Guys, if you have any questions related to how the scribing works, what are the roles and responsibilities of a scribe, anything related to scribing, technical questions, you can feel free to unmute and ask me. Or you can put the message in the chat box and I will go ahead and give a reply to you. I'll be here all through the meeting, so you can feel free to share a message and I will respond. Thank you so much, Ravi.
Thank you, ma'am. Thank you, ma'am. We'll wait for a few more students, ma'am. They'll, if they want
Sure,
to
Ravi,
ask.
sure. I will be here.
Okay. Mm, yeah, here Anisha Vardhaman. She's
Yes, yes.
asking,
I
ma'am,
think
like,
we
does
have
freshers
a
have opportunity for work from home, or any companies you can suggest for work from home?
yes, dear. Thank you so much for the question. First of all, I think Virtual Physician Scribes is one company that fully operates online. So you can uh, connect with them and they provide you work from home opportunities through and through. So you can definitely associate with them. Thank you so much.
Okay, ma'am. Thank you. And any one of guys, if you don't want to unmute yourself and talk, just put in chat box for your question. Okay, Anisha, thank you.
And hello,
Yes, yes.
hello, sir. My name is Hardik, and I just want to ask, like, what questions should I prepare for the interview for the companies?
So, yes, Hardik, that's a very interesting and really important question. So, the questions that you have to prepare for a medical scribing interview would be your English speaking skills, your English grammar knowledge, your medical knowledge, as well as typing. So, these three, four things are the main focus. So, you can work on your medical knowledge, medical terminology, you can work on your typing and English. That's all.
And the certification is also mandatory because as it depends upon your graduation, Hardik. Like if you're in your graduation, in your academics, in your subjects, it is not there. I believe maximum of the curriculum is not designed as per the standards of to get a job in medical scribe. So it is mandatory if you're going to learn something, then only you'll be in a good position or else you'll crack the interview at least. So minimum basics is mandatory, right, ma'am? I believe. Yes, ma'am. Ma'am, are you there? Yes, Hari, how we know regarding the jobs available for medical scribing. Hari, there are other domains like medical coding, pharmacovigilance, etc. Then why should we go with the medical scribing, ma'am? Okay.
So yes, there are different opportunities available. Yes, we have pharmacovigilance, we have medical coding, and all of that. But yes, there are different things as well, right? But depending on what you want, depending on the pathway that you want to go with, if you want a job that pays you well, gives you remote opportunities, has a lot of career growth, and provides you an opportunity to directly connect with healthcare providers abroad, this is the one you can choose for. If not, there are definitely so many other opportunities available as well. So, depending on the choice, you can join our pharmacovigilance programs, you can join our medical coding program. So, we offer different variety of courses. So, depending on your choice, you can go with whatever you want.
Sabha Patan or MPharm students are eligible for the medical scribe. She's asking, ma'am.
Yes, Sabah. So not only pharmacy students, all the lifestyle graduates are eligible to join medical scribing program. And with the certification from Clinoxy, only with the certification from Clinoxy, you can get a lot of opportunities, and we will guide you through the placement process as well.
What are the most essential things required to go for medical scribe?
So yes, Saba, again, good question. If you join with Plinoxy, we will give you all the essential information. We will give you essential training, and we will give you certification. That is more than enough to start your career. So yes.
Okay. Yes, okay, Sabah. So, Sabah, you can reach us, you can contact to this number so that our team is going to help you for the more details if you have any queries also. So, still any questions are there? Still any questions? Still any doubts about the program? Okay. Which type of companies are offering these jobs? Lakshmi.
Yes, Ravi. So,
Yes.
as we have mentioned before, there are different organizations. Once you get certification from us, we directly help you, support you to apply for all these kinds of jobs, and we will help you with the placement. And the certification provided by Clinoxy is valid, and we train you for all the necessary skills, not only required to clear the interview, but also helps you to start the actual scribing process. So, yes.
Okay. Okay. So, ma'am, yes, thank you, ma'am. I'm going forward further the queries, and I'm going to explain about the
Sure,
fever
Ravi. Thank you
details
so
about
much.
this training program. Thank you so much, ma'am.
Thank you, everyone.
Hello, my voice is audible to you. My screen is visible to you guys. Just give me one emoji or else any just confirmation, at least in the chat box, so that I can move forward. Okay, okay, Nisha, thank you for your confirmation. Okay, okay, thank you. So yeah, so you can see our program benefits. So what we are giving. So first, industry recognized certification. So this means like through Indian Pharmaceutical Association, through American Accreditation Association, we are giving the certification, which is recognized national and internationally. So I'll show you how certification it will be the sample next to the slide. So we are giving a hands-on EHR experience, and we are giving flexible learning schedule, means the timings, and we have evening timings, weekly batches. I will explain you in clear manner, and a career placement assistance and a competitive salary potential, means like career placement assistance means, so when you're joining in our training program, 3 months training program, we are going to schedule the interview, means we are going to share you one internal reference. We are making a schedule interview. We are sharing your profile to HRs, making with the sit with in front of interviewer. So one schedule personal reference, or we call it as a schedule interview, we give you, and we are giving you 5 months job assistance to you guys who are joining with a training program. The salary ranges actually already explained about the salary part. Here you can see entry level, we can start with the 4 LPA and experience scribe progress to 6 LPA within a year. And then you can the coming the positions, you can see starting position to up to team lead or experience of minimum 2 years. Here the salary will be the 6 lakh LPA. So from there to you can go as a project manager, health administration, so many things. So here we have so many success stories who got a job in such a good tier 1 companies and tier 2 companies and tier 3 companies in India with a good package, with a starting package of 4.8 LPA and 4.6 LPA and 5.2 LPA and 5 LPA in so many healthcare companies like I guess healthcare, so many scribe EMHR, so many companies are there. So you can see here medical scribe 3 months course, advanced training program we have, that we are giving a 3 months course completion certification with the benefits, 5 months job guidance or assistance we call it as I told you, one personal reference, or we call it as a schedule interview. We only share a profile to the HR and making with sit with of in front of interviewer. If you are losing the chance, the 5 months job guidance is there, and we are giving you LMS support, means daily recording sessions. Example, you have a class Monday to Thursday, and after Thursday, these 4 sessions what you in the week happen, we are going to share you recorded class. Live class is recorded and it is uploaded in our portal. We are giving a logins to you guys in the Friday. Every Friday you are getting a recording classes also, and we are international affiliated course completion certificate. I'll show you how it would be. See here we are, what we have are recognitions of national accreditations, LSSDC and IPA NSDC Skill India, Global Power of Clinoxy course completion certificates through IPA, MSME and NSDC also. You can see here our course completion certificate, how it looks. It is a sample certificate. We are giving a logo here. You can see Indian Pharmaceutical Association, affiliation we have. Under you can see so many Indian accreditations are there, which is Indian government accreditations, central government accreditations, not normal accreditations. And you can see, as I told you, like we are internationally recognized. So you can see this is a national accreditations we have, and here international accreditation what we are giving. So through this American Accreditation Association, so course completion certification, it's going to be weightage upon your resume. It is globally recognized. So how it will be, I will tell you. So this is a sample certificate. This is accreditation certificate. This is a sample certificate. So when you're completing a course in our training program, in our training institution, you will getting a receiving a two certificates. One is this is a course completion certificate of Clean Oxy Solutions with Indian recognition, IPA, and another accreditations also. And you are getting a certification like American Accreditation Association also. This is the American government website, how it shows, and everything I'll tell you. See, what are the benefits of American Accreditation Association means? This certificate, like this, it is sample one, you will get a custom QR code, custom URL. Means if you're scanning this QR code, it is directly redirecting to the website of American Accreditation, and your certificate is visible over there. So if you want to share to this QR code or URL, or you are putting in the LinkedIn, so that the interviewer or HR persons or resource persons, so that they can see and recognize that you are completed the course with international accreditation standards. Our training program matches the curriculum what we are giving a training in these 3 months. The subjects what we are giving a records and everything, it matches to international standards. So that's why we got American accreditation approval. Okay. So this is the key uses and global recognition of American accreditation certificate. If you have a plan of abroad, or if you want to go for abroad opportunities or any study related, university admission and visa process is going to be flexible because it is international standard. And if you want to write an international exams like licenses exams like NAPLEX, TOEFL, GRE, CAPS, PSI, and SPLE, DHA, and PEPSI. So if you want to write an exams also, it is going to be easy, and you'll get a job over there also easy. And industry recognitions. If you want to work in the CRO companies in India, like a contract research organizations and top CRO companies. Example, if you are entering for an interview, or any person is going for interview, if all are going with the normal certifications, they are doing some other institutions. So if you are doing this medical scribe program or whatever the training program with us, it is recognized nationally and internationally, so that more chances of selection by interviewer is there, as we have so many testimonials of that. So if you want to write the government exams like CDSU or drug inspector, railway job opportunities, hospital, and more, this international accreditation, American Accreditation Association certificate is useful for you. So you can see we have four key features for this certification. So first one is personalized design with your photo, like with your 10th class or intermediate or degree mark list, it is going to come with your photo in the website of American government. So online visibility is there. You can share your URL, or else if you want to share your QR code, so everyone can see your certificate when they are going to scan. The certificate is also visible in the American government website only. And easy sharing of URL access and instant access of QR code. So yeah, you can see here how American accreditation certification advancing your career. So global academic advancements. If you want to admissions in top international universities in abroad as well as in India also, it is more helpful for you. We have so many testimonials. One guy got a good scholarship and with the top one university in US and in India also, for the so many programs. In a professional licensing certificate and industry recognition and government sector job opportunities, as I explained in previously. See, yeah, we are taking only 20 members, or 20 seats are available in this batch. Hurry up, guys, if you want to start your medical scribing training program with us. Please enter the number +917416096799. You can contact to this number after the session, or else tomorrow, whatever it may be. You can putting at least just message through WhatsApp. Our team is going to connect with you. Our counselors are there. They are going to help you with more information, and more opportunities and whatever you have queries. So we are taking only limited seats, means like we are taking only 20 students in a batch. So admissions are going on already, registrations are done, so many registrations are done. Hurry up guys, if you want to kickstart your journey in medical scribe, you can contact with us. You can save this number plus 74160 96799. So guys, if you have any queries, I'm here to help you about the training program, about whatever it may be. About the fee structure, our counselors are going to help you. Need not to worry about that. So if you have any queries, let me know. Just you can put in the chat box, or else you can just unmute yourself and you can talk with me. So no queries. Yes, Arun. Okay. Any queries? Any queries, guys? You have? Yes. Okay. Lakshmi, let me. Yeah. No, sir. No, Arun. Okay. So anyone? Niharika, Anshu Kumar, Bhavani, Subhangni, Ashrita, Mallavinita, Sheetal Patil, Disha Patil, Sabha Patan, Hardik, Akhila, Sahiti, Anuja, Kavya. So you have any questions? Let me know. Like I can help you guys. You can put in the chat box or you can unmute yourself and you can ask. No, sir. No, sir. Not for now. Okay. Thank you, Hardik. Thank you for your response. Anyone? Niharika, you have any question? Kavya, have any question? Tisha, you have any question? Sabha, you have any question? You have any questions? Let me know. So I'm sharing the contact number in the chat box also. Guys, yes, you can see contact number in the chat box and you can save this number and you can call directly to this number, or you can just ping a message in the WhatsApp also. Our team is going to connect with you. Guys, if you have any questions, let me know so that we can wind up the session. If you have any queries, just ping me in the chat box so that I can help you with your doubts or queries, whatever it may be. So you guys understand whatever it is. Yes, Hardik, you are a message. Okay. No one is there. Okay, Ashrita. Ashrita, you got. Okay. You have any queries, Ashrita? Your message in chat.
Hello, sir. Actually, I have. This is Ashwita.
Yes, yes, you can talk.
Sir, actually, I have worked for 6 months as medical scribe training in Acuity IKS Health.
Okay.
Yeah, is there any difference for me in joining in this course or?
Yes, Ashrita. Surely you have a difference because as we are meeting the standards of American government and international standards as well as national standards, we design the curriculum it meets to international so that we have accreditation, American Accreditation Association certificate. Okay, so you are currently working, Ashrita, or else you are not working.
But actually, I have resigned during November month. I have worked
Okay.
for 6 months in that company in Visakhapatnam branch.
Okay, as a
We
medical
are
scribe
trained for medical scribe training. We
trainee.
work
Okay.
in the actual EHR, like
Okay.
with the live physicians.
With the
With the live physicians.
okay, okay. So
Yeah.
now you want to restart your career means, yeah, we are ready to help you, Ashrita. So
Yeah, but like actually, I have trained for this, no? Do I need to start from the beginning?
no, Ashrita, when you're when you're going to join in our training program, you what you get an experience is 6 months, right? As you told me. So in our training program, what we are giving the training is, it means minimum of 1 year relevant experience you'll get. So as of now, the trainer ma'am came, she explained you right. She's having more than 10 years experience. So if you are going to train under, like actually you're telling that you are joined as a trainee and you learn something for the company, not for your development process. I believe, am I right or wrong?
Yeah, yeah, actually.
Yeah.
I'm
So
fine.
what I
But
want
I
to
have,
convey you is,
yeah,
so what you learn over there is, yeah, it matches to our curriculum, but not completely. Because as a fresh, if anyone fresher are joining in our training program, they are going to, after completing this training program, they are going to gain knowledge, and they are going to get an experience minimum of 2 years relevant knowledge we are sharing you. So that, like, you will, like, you are not a fresher, because like, actually you're telling, you as a fresher you trained over there 6 months. Sir, this is enough for me to get a job, or else this is enough for me to start my career, is your question. Am I right or wrong?
yeah, yeah.
Yeah.
Do
So
I
I
need
want
to
to convey you
learn
for the
from the
question is,
beginning? Yeah.
yes.
Do I need to learn from the beginning, or if
No,
I
no, no.
take this like
In this training program, you are going to start
starting
from the,
from good
yeah,
to
beginning means what you learn in a previous company, we don't know, right? Am I right or
yeah,
wrong?
yeah, yeah, yeah,
So it matches. It is going to matches with our curriculum, or I don't know. Max, it is going to matches, but it is not completely. I'm telling you again and again. So you can start with a journey, so that we are going to like, make you to conduct the interviews also, to start your career with a good opportunities. So that is I want to tell you. If you want to more information also, we will connect you uh, through contact also. So I message you in the chat box, right? So you can just call to this number. Our team is going to connect with you and help you the queries. So my suggestion is, like, you can start from beginning. So actually you're telling from November you resigned your company. We too don't know, like you too don't know what you learn over there. So start your, if you want to start your career with a proper knowledge, and with a good company, you need to learn in a from the basics only, right? From the starting
yes,
only.
sir, yes.
Yeah, you can, if you're having a foundation is strong, you can make the pillars. How many pillars if you want to do, you can. So same thing here, if you're having a good knowledge, in a proper manner, what you learned previously, I don't know. So you're getting a good opportunity to work in so many companies, not only one company. They're going to pay you more than what you having a previous salary also. Okay. So
Yes.
for your more queries, surely Ashita, we will connect with you. Just you can like, just you can message in the to this number what I message you in the chat box, so that we
Yes,
can
sir.
connect with you.
Thank you, sir. Thank you for that.
Okay. So, sir, nowadays certificate have not that much importance. Everyone get it by purchasing. So, what different in it, so that we can agree to get it? So, Sabapatan, I want to tell you one thing for this query. So, certificate they are buying, but they can't get knowledge. What I want to tell you is, I'll get a certificate if I want to buy anything. Yeah, I will buy, but I can't get a knowledge, right? So your question is, certificate have, nowadays certificate have not that much importance. Everyone get it by purchasing. So that, so what we, yeah. So it is deleted or else what it? Yeah. Mm, so our stop it. Our students okay. International affiliated. Okay. If you got certificate from unrecognized and unaffiliated organizations, Sabha Patan, like, Sabha, are you there? So I want to give you answer for that. So you can buy the certificate, but you can't buy the knowledge, right? So simply as, if you're getting a certificate, if you're not performing in the in front of interviewer, means what will it be? What is there? So if your example, if I'm getting a 10th class certificate if I'm not at all studying and paying the money. If I want to get any job, or if I want to write any apply anything, means I'm not studied over there, right? So how can I example simply I want to tell you, if I am getting a medical scribe certificate from different organization paying some 30,000 or 40,000, when you sitting in front of interviewer, or else when you're attending the interviews, you bought certificate but you didn't get a knowledge, right? So if you're sitting with the in front of interviewers also, you can't able to answer the questions because you have only certificate, not knowledge.
Ravi,
Simply I want to tell you,
Ravi.
sir.
Yeah, and already answered her question. Okay.
Okay, sir.
Okay, and you can go ahead.
Okay, so okay. Okay, if you have any queries, let me know, guys. So we are going to wind up the session. So this is our contact number. I'm mentioning the chat box again. So kindly contact us if you have any queries. So here we mentioned the link also, so that join the link and you can update yourself, like your details, so that our team is going to connect with you. So thank you, guys. If you have any questions, finally I'm going to just ask you, if you have any questions, just let me ping in the WhatsApp in this to this number, or else in the chat box, or else you can unmute yourself, you can talk. No means just give me emojis, or else just in a chat box you can just let me know, so that we are going to wind up the session. Okay. Okay.